In the heart of the Islamic Golden Age, a period of remarkable intellectual and cultural flourishing, there lived a figure whose contributions to medicine continue to shape the field today. This genius was none other than Al-Razi, also known as Rhazes in the West. Often referred to as the father of modern medicine, Al-Razi's groundbreaking work in both clinical practice and medical theory set new standards and revolutionized the way diseases were understood and treated. In today's video, we'll take a deep dive into the life and contributions of this extraordinary scholar, exploring how his innovations paved the way for modern medical practices. Born in the city of Rey, present-day Iran, around 865 CE, Al-Razi began his studies in various fields, including philosophy, chemistry, and medicine. His broad intellectual pursuits shaped his medical career, allowing him to bring a unique perspective to the healing arts. His approach to medicine was based on experimentation, observation, and logic, making him a pioneer in the scientific method long before it became standard practice in Europe. His critical thinking and refusal to accept traditional beliefs without evidence led him to challenge the accepted medical norms of his time, earning him a reputation as a visionary and a rebellious thinker. One of Al-Razi's most significant contributions was his work on the understanding of diseases. At a time when medical knowledge was still heavily influenced by Greek and Roman texts, many of which were based on superstition or unverified beliefs, Al-Razi was determined to make medicine more empirical. He was one of the first to make a distinction between measles and smallpox, two diseases that had often been confused with one another. By carefully observing symptoms and conducting numerous clinical experiments, he developed a clear understanding of their differences, helping future generations of physicians differentiate between them. Al-Razi's influence also extended to his writings. His most famous work, Kitab al-Hawi, the comprehensive book, was an extensive medical encyclopedia that compiled knowledge from ancient Greek, Roman, and Persian medicine. However, it was his personal additions to this work that made it revolutionary. In this book, he included his own observations, treatments, and diagnoses, many of which were based on his hands-on experience as a practicing physician. The Kitab al-Hawi became a standard reference in both the Islamic world and later in Europe, influencing scholars for centuries to come. Al-Razi was not only a great theorist, but also an exceptional clinician. His role as a physician in Baghdad, where he was appointed head of the city's largest hospital, allowed him to develop and implement many innovative techniques. Under his leadership, the hospital became a center of excellence, attracting patients and scholars from all over the Muslim world. His emphasis on clinical trials and patient observation set new standards for medical practice. He believed that a physician should never rely solely on textbooks, but should observe and treat patients with care, using the knowledge gained from direct experience. Another groundbreaking aspect of Al-Razi's work was his advocacy for the use of chemical substances in medicine. He was a pioneer in the field of pharmacology and conducted extensive research on various substances, particularly alcohol, which he used as a solvent and antiseptic. Al-Razi's work with chemicals also led him to discover new medicines and treatments, including the use of sulfur for treating skin conditions. His approach to medicine was holistic, considering the patient's overall well-being rather than just focusing on symptoms.